there, I'm Nick Oda from GingaTech Solutions. October is Cybersecurity Awareness Month, and there's a lot of interesting things that you may not be aware of or that could help you be safer. Who manages your IT? Are they cybersecurity certified? What types of certifications do they have? Some organizations hire internally and have a technician working for them. Some smaller organizations, and even large ones, may outsource their IT to MSPs or managed service providers, like my company, GingaTech Solutions. We come in and make sure that our clients are secured, we provide help desk services, and many others. We want to make sure that our clients are safe, secure, but not only that, also compliant. Did you know that there are provincial and federal regulations on how to manage your client data? For example, having a business firewall is critical. Making sure that the security on your network is as good as possible, that you've done your due diligence. Do you have antivirus on your computer? Is it the free kind or is it a paid subscription? Because that makes a huge difference as well. Cybersecurity solutions come in wide varieties. Making sure that your team or your technician is certified and understands the threat landscape is very important. Business owners, directors, managers, and their employees are probably not cybersecurity certified. There's a level of blind trust that occurs with the IT provider. It's important to understand what level of cybersecurity protection they can offer. Are they certified? Have they had any formal training? Are they helping you secure your environment or simply providing a break-fix service? My computer's broken, please fix it. My printer's not working. A lot of these services are different and require different types of certifications. Are the IT providers protecting your organization? Make sure to ask the right questions. Like, what's my antivirus? Is it a modern type of antivirus? Do I have MDR, XDR, EDR? All of these acronyms can add up and they can get pretty complicated. But sometimes just asking the questions may yield a good response, or if they seem to not know, then that might be time to get a consult and look at alternatives. When you think of a hospital, you probably think they have really great cybersecurity protection. And you're probably right, they probably do. However, do all the little organizations they work with and partner with have those same protections as well? Not likely. Some of these cybersecurity solutions for large organizations such as a hospital may cost tens of thousands of dollars per month, where a little 4 to 10 person organization providing community health services may not have that kind of a budget. But it's just as important for them to have proper cybersecurity solutions in place, especially if they have links with larger organizations. Maybe they're using some sort of VPN tunnel or data exchange or file sharing service. The last thing the hospital wants is to deal with a breach because one of their smaller partners wasn't compliant with their cybersecurity. These are important things to ask when you go to your family doctor. Have you ever even thought, I wonder how they're protecting my medical information, my personal private data? There are federal and provincial regulations in place that dictate how these healthcare organizations have to manage their data, but not all of them comply. And that can be an important factor for certain people. Hospitals have been breached through small affiliate partner organizations, but sometimes your family clinic may be just as vulnerable. Though you may wonder, what's a hacker going to do with my medical data? Well, sometimes it's not necessarily about the individual, but that information could be sold on the dark web or in black markets, where, as silly as it may sound, insurance companies may gain access to that and deny claims. It can have a pretty major impact. Have you ever submitted your DNA to an ancestry website or to look for genetic markers? What happens if that company gets breached and the data is stolen? Sometimes these breaches can amount to a lot more than you may think. Your DNA may be out there. Insurance companies could decide to refuse a claim if they see genetic markers for certain predispositions to disorders. Not only that, DNA could also be used for identity. When you share your data, your personal information with organizations, it's important to understand what risks come with that. Are people you share your data with keeping it safe and secure? Are they meeting compliance? Kind of things that we don't really think about when we go and share our data. But they're definitely questions we should be asking. We share maybe our address or our phone number, email, probably several times in a week. Maybe we sign up for a newsletter. Do we know that the organization we shared our data with are properly managing their data and using cybersecurity tools and protections? Are they meeting compliance?